Traveling opens up a world of experiences, cultures, and breathtaking landscapes, but it also comes with its own set of challenges, particularly when it comes to health. As wanderlust drives us to explore distant lands, we must be vigilant about the health risks that lurk in unfamiliar environments. Among these risks, infectious diseases such as malaria, dengue fever, and traveler's diarrhea stand out, threatening to turn a dream vacation into a nightmare. Understanding these diseases and their prevention is vital for any traveler. Malaria, a mosquito-borne disease, remains one of the most significant health threats in many tropical and subtropical regions. Each year, millions of travelers visit areas where malaria is endemic, often unaware of the risks. The malaria parasite, transmitted through the bites of infected female Anopheles mosquitoes, can lead to severe illness and even death if not treated promptly. The symptoms often include fever, chills, and flu-like illness, which can develop as soon as a week after being bitten. To prevent malaria, travelers should consider several strategies. First and foremost, it is essential to consult a healthcare provider well before embarking on a journey to a malaria-endemic area. They can recommend anti-malarial medications tailored to the specific region and the traveler's health profile. These medications are most effective when taken as prescribed, starting before travel and continuing after returning home. In addition to medication, protective measures against mosquito bites are crucial. Wearing long-sleeved clothing, using insect repellent containing DEET, and sleeping under mosquito nets can significantly reduce the risk of bites. Travelers should also be mindful of their surroundings, especially during dusk and dawn when mosquitoes are most active. By combining medication with preventive measures, travelers can enjoy their adventures with greater peace of mind. Dengue fever, another mosquito-borne illness, poses a significant threat in many tropical and subtropical regions. Unlike malaria, dengue is transmitted by Aedes mosquitoes, particularly Aedes aegypti and Aedes albopictus, which are often found in urban areas. Dengue fever can cause severe flu-like symptoms, including high fever, severe headaches, pain behind the eyes, and joint and muscle pain. In some cases, the disease can progress to dengue hemorrhagic fever, a more severe form that can be fatal. Preventing dengue fever largely mirrors the strategies for malaria. Travelers should prioritize mosquito bite prevention, as there is no specific antiviral treatment for dengue. The same insect repellents, protective clothing, and mosquito nets can be effective. Additionally, travelers should be cautious about standing water where mosquitoes breed, and should avoid areas with high mosquito populations, especially during the day when Aedes mosquitoes are most active. Vaccination is another critical aspect of health protection when traveling. While there is no specific vaccine for malaria, the development of the RTS-S01 Mosquirix vaccine marks a significant step forward in malaria prevention, particularly for young children in endemic areas. For dengue, a vaccine called Dengvaxia is available, but it is recommended only for individuals who have previously been infected with the virus, as vaccination in those without prior exposure can lead to more severe disease upon subsequent infection. Traveler's diarrhea is perhaps the most common ailment affecting travelers, particularly those venturing into areas with different sanitation standards. This condition is often caused by consuming contaminated food or water, leading to symptoms such as abdominal cramps, nausea, vomiting, and diarrhea. While usually self-limiting, it can lead to dehydration, which can be particularly dangerous for young children and the elderly. Preventing travelers' diarrhea requires vigilance regarding food and water consumption. Travelers should drink only bottled or purified water and avoid ice made from unfiltered water. Street food can be tempting, but it is essential to ensure that it is cooked thoroughly and served hot. Fresh fruits and vegetables should be washed with clean water or peeled before consumption. Additionally, maintaining good hand hygiene, washing hands frequently with soap and water, or using hand sanitizer can help minimize the risk of infection. In some cases, travelers may consider taking preventive antibiotics, especially if they are traveling to high-risk areas or have a history of severe traveler's diarrhea. However, this should be done under the guidance of a healthcare professional as unnecessary antibiotic use can contribute to antibiotic resistance and other health issues. As the world becomes more interconnected, the importance of vaccinations cannot be overstated. Vaccines serve as a frontline defense against many infectious diseases that travelers may encounter. For example, vaccines for hepatitis A and B, typhoid fever, and yellow fever are recommended for travelers heading to specific regions. These vaccines can provide crucial protection against diseases that could derail a trip and lead to long-term health consequences. Before embarking on any journey, travelers should conduct thorough research on the health risks associated with their destination. This includes understanding the prevalence of infectious diseases, the availability of healthcare facilities, and any necessary vaccinations. Consulting with a travel medicine specialist can provide personalized recommendations tailored to individual health needs and travel plans. In conclusion, while travel is an enriching experience, it comes with inherent health risks that require careful consideration. Infectious diseases such as malaria, dengue fever, and traveler's diarrhea can pose serious threats. But with the right knowledge and preventive measures, travelers can safeguard their health. By taking proactive steps, such as consulting healthcare providers, using preventive medications, practicing good hygiene, and staying informed about vaccinations, travelers can embark on their adventures with confidence. Ultimately, a little preparation can go a long way in ensuring that the journey is filled with joy rather than health concerns.